Hi guys, my name is Dr. Mona Hardas. I'm a cosmetic gynecologist from Michigan, USA, and I love to teach women and empower women with knowledge about their health, their reproductive organs, anatomy, anything related to women's health. So today I wanted to talk to you about G-Spot augmentation. G-spot is an area which is in the anterior vaginal wall, right near the urethra, just behind the urethra where you pee from. And this is a very sensitive area. And the name G-spot comes because of the scientist called Grafenberg who first discovered this area. He noticed that stimulation of this area in the anterior vaginal wall and the top near the urethra where you pee from. So stimulation of this area can cause orgasm in women. And he was very intrigued by this finding. And further research showed that there's a ganglion or increased nerve endings in that area. And many women who get orgasm because of vaginal stimulation get it because of the stimulation of this G-spot. So G-spot augmentation idea came from the fact that as we get older with the changes in our hormonal balance, the decrease in the estrogen, decreased sensitivity of the vaginal tissue, there's a decreased sensitivity of this area, which is a G-spot area. Also, during and after childbirth, because the vagina get really stretched out, the muscle tone of the vaginal muscles or the pelvic floor muscles is decreased, and the vaginal opening, which used to be narrow and tight before the childbirth, becomes a little bit looser and wider. So when it is wider during penetrative sex, there is more room, so there is no tightness, right? So there is no stimulation, there is no friction of the G-spot. So women after childbirth a lot of time feel that, oh, the sex doesn't feel the same. Women in perimenopause, menopause feel the same. And also some women who had a surgery, say they had a bladder prolapse surgery or a vaginal hysterectomy surgery, whenever there was a surgical procedure done involving the anterior part of the vaginal wall, this G-spot sensitivity decreases, because instead of that sensitive nerve tissue, there's more of a scar tissue. And that's when the research started thinking, okay, what can we do to make this more sensitive so sex is as not comfortable but enjoyable for a woman as it used to be in the past. So the research has shown that if we augment that means if you stimulate that G-spot area by causing growth of the nerve endings there, the sensitivity should come back. So what we do is that we use something called a PRP, or a platelet-rich plasma. Basically, we draw your blood and we separate the blood cells, which are the red blood cells which carry oxygen to the tissue, from the plasma. Now, plasma is also called liquid gold because what this plasma has is a bunch of growth factors. So what we do is that we actually inject them into the G-spot area. So this growth factor is going to stimulate the nerve ending, and there's going to be the growth of the nerve ending, which is going to make this area more sensitive. And this should last at least for a long time, right? At least for a year or so. Now, this procedure, which I'm telling you about, injecting the PRP in that area, is completely painless, zero pain. I promise you, zero pain, because we numb the area before we do the procedure anyways. So that's one way of augmenting the G-spot. The second way of augmenting is by making that area bulkier, making it bulky so that during penetrative sex there is a friction there, and this friction will cause stimulation of the G-spot. So for that we use hyaluronic acid fillers. There are a bunch of fillers on the market, and what I usually use in my practice is the Allergan products, which is the Voluma. Now, once the filler is injected, it has to be injected by somebody who's trained in doing that. Because if the filler is not injected in a right space, that's number one, is useless. Number two, it can cause complications, including something called granuloma. Granulomas are nothing but a very painful tender nodules, and they are because of the hyaluronic acid, and they will make sex painful, not painless or not enjoyable. So please, if you're gonna get the G-Spot augmentation with the HA filler, then make sure the person is well trained. But in a well trained hand, it's a very simple procedure. It start working in about within a week as well. It causes bulkiness in that area, which will stimulate the G-spot, and it will last for about 18 to 24 months. Simple procedure, very helpful. If you need any more information on it, if you want to know about it, know more statistics about it, please call my office. All my information is linked down below. If you have any questions, please again note it down below, and I will answer them back.